ECQ was founded in 2001, and it was started as a nonprofit because we all came from that world, and we had all come up sort of as program people in different nonprofit agencies in New York City. It was founded as a group practice with colleagues that had worked together for a long time and knew each other well. And it was really started as a small group of mid to senior level nonprofit managers who had done direct service for a long time and had realized that some of the challenges they saw were true across all agencies. And so that the solution was bigger than or broader than one particular nonprofit. And when people started thinking about the problems or the shortcomings within the sector, it became obvious that there were certain strategies that could work for many different agencies for them to be more effective and to run more efficiently and to really survive in difficult times. When we started in 2001, we really never thought that we would be working again doing technical assistance and training 10 years later. But the need is still there, and now because of the recession, it's probably there more than ever. But it is also obvious that some changes have to be on a policy level or a legislative level, and that kind of change really has to come from many, many different interest groups, I guess, or different professions working together in a more unified way than we've done in the past. So in 2001, we incorporated as a not-for-profit. I was the founder and the executive director, and we had some really terrific founding board members, and they included Linda Manley from the Lawyers Alliance of New York, Joseph Musker, who at the time was a health policy analyst in Washington, D.C. We also had Louis Medina, who is the executive director of St. Christopher's, which was the largest minority foster care child welfare agency, and they were located in Dobbs Ferry in Westchester. And it was really because of Luis that we were able to start ECQ, because they served as our fiscal conduit until we were incorporated not only in New York State as a not-for-profit, but with the federal government as our own 501c3. So our first office was actually in Harlem on 127th Street, and kids would come in all the time, often very much in distress, so it felt sort of like we were still doing direct service, but one step removed, because now the clients were the agencies rather than the individual clients that those agencies serve. But ECQ's client base has always been agencies in New York City and throughout the state, really, that serve the poorest and most vulnerable populations. And what that often looks like is either immigrant groups or lesbian, gay, bisexual, transgender groups, criminal justice, re-entry populations, substance users, people living with HIV and AIDS. And our expertise has always been public health. So it was an interesting intersection of public health and nonprofit management, I think, that made us very different than the other groups that were working in the field. So over the years, we ended up doing a lot of very technical writing for the New York City Department of Health and Mental Hygiene, the New York State Department of Health AIDS Institute, the Office of Minority Health, SAMHSA, Centers for Disease Control, very sort of broad public health planning and grant writing and report writing. And that really made us very different than a lot of the other nonprofit consulting firms that specialize more in organizational development than in public health. I think the other thing that happened over time was that the people who came to ECQ all came from a certain community that we ended up being a part of, whether they were part of the lesbian and gay community or part of the immigrant community or women of color, the senior leadership and the board always were very representative of the client agencies that we served. So we began in Harlem, and then we moved to Midtown, and now we're in Washington Heights. So it really feels like we've come full circle, and we're very happy to be back in the neighborhood, more or less where we started from the very beginning. So after 10 years, certain things are happening in the field that are going to change the face of ECQ, and I also think change the face of the entire field of nonprofit. And that's largely because of the economic recession that no one expected and no one was prepared for. And the focus now is really on job placement and job creation and getting unemployed adults back to work, and possibly people who were laid off from the corporate world entering the nonprofit sector. So one of the new programs that ECQ has worked on is a certificate program in nonprofit management, and we are doing it in conjunction with the Borough of Manhattan Community College, which is one of the biggest community colleges in the United States. They have 18,000 students. And this project will be offered through the Department of Continuing Education. And the hope is over time to have the training program and then a job placement here at ECQ, and after the job placement to get people out and working in the nonprofit field with some really tangible, concrete, needed skills in nonprofit. And those skills are really grant writing, fiscal management and fiscal accounting, and evaluation. Those seem to be the three jobs that are the hardest to fill and hardest to find people who are either well prepared or have practical experience as opposed to just schoolwork. And so we're really trying to focus on those three areas and give people skills that will help them enter the job market. The other thing that we're seeing a lot of is this need for women and minorities to create their own for-profit entities, because there is so little money and so much competition in the nonprofit sector for the same grant dollars. So basically, the Small Business Administration is making a big push to support what I would call entrepreneurs from non-traditional areas of the economy, namely women, immigrants, people of color, women who have not had a lot of job experience. And there's a very big push and initiative to get these people up and running so that one day, if they choose to, they can open their own practice.